Thank you for tuning in to the SkillsAware podcast. We are a human-centered, AI-powered skills recognition engine transforming how people and organizations understand and grow their capabilities. Each episode features insightful conversations with industry leaders, experts, and innovators who share their knowledge, experiences, and ideas on workforce skills, skills recognition, skills literacy, artificial intelligence, and so much more.
Good afternoon, everybody, and welcome. I'd like to begin by acknowledging the traditional owners of the lands on which we're meeting today. And while we're joining you from all across the country, I'd like to pay my respects to elders past and present and extend that respect to any Aboriginal and Torres Strait Islander peoples who are with us today. And as we discuss productivity and opportunity, I think it's important to recognise that this country holds the world's oldest continuing cultures, whose skills and learnings have always been built through lived experience, community and practice. I have great pleasure today in introducing Meredith Coote to join our conversation. Now, Meredith brings 39 years of experience across Australia's social care sector. She clearly started when she was one, working in diverse leadership, policy, practice and innovation roles across aged care, disability and mental health, and with a consistent focus on improving outcomes for people and for families. She's been integral in developing the Mabel platform during its formative years and was co-chair of the National Carer Strategy and is a current member of the New South Wales Ministerial Advisory Council on Ageing. And Meredith also brings her own lived experience as a carer to her work and is passionate about helping unpaid carers recognise and translate their often invisible skills developed through caring into recognised expertise and capability. So that makes her absolutely the perfect person to join this conversation about what would the world look like if we could take those previously invisible capability skills and make them visible and portable and recognised across the sector. What do you think that would have in terms of impact on the future workforce, Meredith?
Good opening. Thank you very much, Yasmin. It's really nice to be here. Look, I think if we could turn the invisible into the visible, it firstly fundamentally changes who we see as part of our future care workforce. That's, I guess, the first thing. There's this enormous pool of capability that exists within families, communities, volunteering, the peer workspace, and unpaid caring that we know our traditional recruitment systems just don't recognise. And I think it really starts changing the starting question for what qualifications do you have to what can you do and how do we know? So I think that's probably my starter.
And what do you think are the relevance and benefits of someone actually having lived experience in providing that care support work?
Look, I think it's we bring so much through our lives. We've all got lived experience. We've got lived experience of living, let's be honest. But it brings this relational intelligence piece to the work, which is absolutely critical. And I think values, and I think the values that we bring are the most important piece that we bring to our work. And so, I think these lived experience workers bring the relational intelligence, which means that they notice the subtle changes, they understand the complications of everyday life, and that when you walk into a home, you're not just seeing a person, you're trying to look around them, you're understanding what happened last night, you're understanding about the day, you're asking them about what else is actually impacting on how they're presenting to you today, because you know that none of us live on an island and we're impacted by absolutely everything that is around us. They bring this, I guess, the lack of judgment. So just understanding that life isn't always the way we want it to be. And true adaptability, I think it's this adaptive, flexible, agile piece that, that lived experience unpaid carers bring to the workforce is really critical. And I think that lens of I'm looking at everything, I'm noticing the things that are happening around this home, I'm noticing that you're not as well as you seemed yesterday and you seemed okay. So the ability to look much more globally, to have a lens that's more inclusive and holistic, and one that isn't just focused on a task.
Yeah. And so why do you think, though, there has been so little action in this space to try and codify those skills? I mean, I know there's been a couple of pilots that have been tried in the past that fell over because, and usually it was because the comment was, well, we can't get the trainers and assessors to basically, assess their capability. And it always falls in the too hard basket. Why do you think that is?
I think it's up until now, thanks to you, the inability to assess the capability, the fact that we're so limited in what we're assessing. And the question, I mean, really, you're only getting back what you ask. And so you're not actually looking at a person's journey. You're not looking at paid and unpaid work. You're not looking at the soft skills, which are fundamental to these jobs in the care and support workforce. And so if you don't ask, you don't know. But I also think that the carers don't see or value their experience from all of the expertise that they have. I mean, they are the most extraordinary navigators of systems. They know how to, access every possible paid, unpaid, formal, informal, support that exists in their communities and in their universes. And so I think, first of all, you've got to help people see themselves differently and give them the language around how do I explain what my experience is and value it. And then you've got to do the other side of the pillar, which is really important, which is how do you get people to ask the right questions so you are picking that up. And then the third piece is how do you put all that together in a great passport of here's all of the skills, knowledge and expertise that I have, and how does that bring value to this role?
And do you think the fact that the workforce is highly casualised? I mean, we've been talking, for example, in the aged care space, and one of the feedbacks that we've had is that you can sort of design really good processes, but the reality is, it's casual staff coming in or agency staff coming in. They're not invested in the workplace, so they do totally fall back to basically looking at things in terms of task orientation because they have no ongoing relationship with the organisation or with certainly the people who are, for example, in a residential facility, or it might be a an independent living environment, and so how much do you think, if those workers actually had lived experience, would make a difference? Because even though they were only coming in and out of an environment, their lens would be different.
Makes a fundamental difference. And I think, just as an aside, we know that the pricing structures don't allow anyway, even for people who are permanently employed in organizations, it doesn't allow for the training and the really important supervision and perspectives that we all know are really important to understanding our scope of practice. So we're losing that anyway. So I think when you come in with lived experience, with such expertise in understanding how to be person-centered really quickly. So how do I come in and say, regardless of what's going on, what do you need today? Yes. How are you? What's happening right now? And being able to really focus and not think, well, I've got to go and check that the toilet's clean and the shower's clean. So focusing really quickly is a real skill. So I think getting back to the first part, just the casualization, we have to accept that's, I guess, part of what our workforce is going to be. So how do we address it? So how do we help people get up to speed really quickly with really important information they need right now, and then they can get on with as a old-fashioned psychologist, what the presenting problem is right now. And so, I think this ability for people who have experience, and I think I want to say that lived experience doesn't necessarily doesn't mean they have all of the competencies, but what you're doing is building on a really important scaffold that's there already. And so I think they do have a better lens at honing in really quickly, understanding the complexities that can occur, and understanding really importantly, which is, I guess, something I learned through the commencement of the Mabel platform, is that, I might be down to come and, I don't know, shower you today, but actually something really hard's happened to you tonight. You don't want to shower. You need to do something else. And I'm going to be flexible enough to understand that's the most important thing that I do first for you. So, when we're deeply transactional and based on checklists, we often don't meet the actual need that's in front of us. And that's what people with all of those other experiences in life bring to the table. Did that answer your question? It was a little
Yeah.
long-winded.
No, absolutely. I mean, and I mean, what about peer support? Because I mean, I remember, when we were involved in developing the training packages, there was a peer mental health qualification, and it was often, derided and, well, certainly not used. But in fact, actually now we hear that actually there's far more interest in it because they've learned that actually they're really fantastic mental health workers. Do you want to comment about that?
Yeah, look, we do a lot of work in the peer support, and not just peer support, but in peer support carer workforce, which is also an emerging workforce. And so, there's a skill in using this lived experience intentionally rather than just centering it. So actually bringing people in purposefully. And carer peer workers really learn that sharing that personal experience should have a purpose and directly benefit the person. So you're not just saying, I've got this thing in the background, but you're thinking, how can I bring my expertise to this person? That requires some skill around. Not everyone's circumstances are obviously going to be the same, but the principle translates really beautiful and I guess into broader support work. So it's become really central. It's not valued enough. And I know that there's carer peer support workers and peer support workers that feel like they sit on the outer of some of these workforce systems and they're not considered. And I think that's what we need to elevate is, certainly as someone that uses peer support workers and carer peer support workers, it's a game changer in terms of someone that comes into your life that isn't judging you, that isn't thinking, why haven't you done this or that? And perhaps, without saying you should do this, is have you thought about doing it this way because they've done it themselves? So I think for the person receiving the support, it's fundamentally important that, yes, you come with a competency, but you also feel like they understand what good support might look and feel like to you because they've done it or heard it or experienced or seen it before. And can really, I guess it's the head, heart, and hands piece, right? It's leaning in a way where they're bringing their competency, they're bringing their compassion, and they're also bringing this real practicality to the space.
Yeah. And given that so much now of, even though there is a requirement for a large piece of work placement in it, we still hear from employers that they have people entering the workforce who have a qualification and they basically can't, just basically are not able to do the role. And it's not about that they needed to be inducted. It's actually far more basic than that. And I wonder how much of that has been because, we need volumes of people churning through instead of actually focusing on what does quality look like?
Yes. And also, I think people need to taste it before they do it. And I've heard a lot of conversations recently about young nurses who've gone and done nursing and don't want to do it. They don't like it. And so, if you bring a lived experience workforce first, they're entering knowing that there's something about them that wants to do this work. So you kind of wasted, that training. So it's a really good, it's a positive piece to think, well, I already know that I'm good at this, whether I like it or not. And so how can I use that, I guess, superpower of just a natural love or compassion or desire to do this work and then turn that into a competency and qualification that I know I'm going to use, as opposed to have wasted that time. We want people who have the right values, who have compassion, who have understanding, and who ultimately want to stay in this sector and do the many different, versions that it can lead you as well.
Yeah. So you would say that making the invisible visible, that capability visible, but also being able for it to be portable so that it's owned by the individual and that it's recognised would be a very positive impact in
Absolutely. Look, improving portability, means that workers can really take evidence of their capabilities to wherever they go. They can take platforms and sectors and provide wherever they want to go, rather than having their experience effectively disappear every time they go to a new job. And I think that's what happens now. And it provides much clearer career progression for them too, because they can then go, they can see where it might build, all of their competencies might build, and they could actually elevate in the industry. And I think that often doesn't happen. And I think for employers, it actually helps better recruitment and workforce development because you can identify capability gaps much more easily because you can see what they've done, not just a kind of list of qualifications. You can actually, rather than a generic qualification. So there's this much more credible and consistent way of verifying their capability, which then you can match to their jobs much better.
And you can actually upskill instead of just repeat compliance training, which we know happens a lot now. I'd like to introduce Mark. Mark Keough is one of the directors and co-founders of SkillsAware. And Mark, I mean, you also, you work as a mediator and involved in EAP programs as well in your career, as well as obviously having a long passion about how do we recognise life-wide skills. Do you want to add anything before we basically lead into why we've gone on this journey of trying to make the invisible visible?
Yeah, all I would say is it's great to hear the affirmation from, the industry expertise that Meredith brings and for what we're doing. Of course, we're finding this across a number of industries. It's not just home care the care workers because portability's increased in workforces. People don't do lifelong careers anymore. They do life-wide work. And in that sense, it's important to understand how can they document that. And as you say, Meredith, not have to start again from scratch. Sorry, my phone inadvertently rang at a bad time. And so, I just want to affirm everything you both said. We see this clearly. What got me started on this was some years ago trying to match jobs to learning, job descriptions, job profiles to learning outcomes. And they are a bit like oil and water, and that's not okay. And I think the current trend towards open recognition and micro-credentialing and, breaking things down into smaller bits is going to really support the future.
So do you want to show a bit about the Mark?
Why don't we? I'll just do a quick run through, and then it'd be great just to get Meredith's reaction. I know you've perhaps seen it before, but so can you see that screen?
Yes, we can.
Great, that's encouraging always. So what we're looking at here is the SkillsAware dashboard, and SkillsAware contains three major components. One is based on evidence you load your suggested skills. Then it's got my skills, which are the skills you're working on and actively trying to have recognised. And then there's an evidence hub where you can load evidence from time to time. I'll just show how the workflow works, because when you first log on, you're asked for a profile and as a questionnaire, and you simply fill in background and experience. But from the very beginning, you can start loading evidence, and evidence can be in all of these formats, including video, audio, PowerPoints from a training course you might have gone to, PDFs, documents, pictures of certificates, a whole range of things there that you can load as evidence. And so instead of having to gather up folders and folders of evidence and give it to someone to verify, you can actually load it in here. And what happens is you're also asked about some of the generic skills you've got, what we call transferable or durable skills or life skills, qualifications and courses you may have done. And if you take your time over this and start loading evidence from the beginning, and also then volunteering, personal interests and hobbies and so on, it allows for the next stage, which is, let me just go to, and sorry we're clicking through quickly, but really we don't have time to do a comprehensive overview today, but this is just to get a visual feel. The next stage is to go to the Skills Assistant, which is an AI-driven agent who will help you clarify your evidence, improve your evidence, answer questions about what might be evidence. And we measure evidence in three forms. And we can see here There's certify evidence where you've got some formal qualification from somewhere. There's organisational evidence, which documents connected to your work or training. And then there's self-claimed evidence, which is a narrative about who you are and what you can do. And we like to think we're one of the first systems that's really genuinely taking your own claim of what you can do seriously. And we think it's very important and too often ignored. Quite often it's a great starting point to say, look, I've done this, I've done that. I don't have any documents, but at least I've got the experience. And that's a very important part of what we want to document. The simple workflow process then goes where you can, you have a range of suggested skills and you can filter and sort these and it'll show details. These skills come from the Australian training packages, so they align for recognition of prior learning with certificate through to diploma level qualifications. And so they that allows, if you want to get formal recognition, but even if you just want to get recognition from your employer or from the situation you're in or for a job that you're going for, then it shows the basic information from the training package. What we then go to, you can add a skill to your My Skills, and that says, I want to start working on something. And when you do that, and let's just assume you've addressed the needs of chronic disease, and I'll send that off to add, the AI starts to analyze the skill against the evidence. And what it will do, I'll just go to My Skills, is it will give you a score that the probability of the evidence you've provided is sufficient for the purpose. Now, in this particular one, support independence and well-being, it's a very high score, and that's because our friend here, who happens to be called Florence Nightingale, which is just it's a made up name, but we also made the evidence up here just for demonstration purposes, but has some formal qualification as part of their evidence. And so that has a very high score. Let's have a look at that. What that says is their formal score, they must have a qualification in this already, must have completed this unit or some very similar unit, which has given them a certificate. And also they've got a lot of experience. And that's the useful profile. It tells you not only have I got the qualification, but I have the experience and I've documented my experience. The other parts on this screen are some processes that you go through to improve your score. Down here is the detailed evidence of what parts of your evidence contributed to the various elements in this training package unit of competency. And so promote independence, recognize, support individual differences, and it documents the evidence that shows that. One of the things you can do is you can also get endorsement from a peer or a supervisor, and that's a process. I won't go through it now, but it's an encrypted process where you can write an email off to a supervisor and get endorsement for this skill for support, independence, and well-being. What?
Yep, Meredith, you've got a question?
Go, Meredith, yeah.
Could you get endorsement from a person that you'd provided support for?
You could too.
Absolutely.
One of the rules we've got though is that there are ways of getting that, and you'd probably do that in conjunction with the supervisor, because we protect that the encryption. The email has to go to someone in an organization. But if in combination, getting feedback from someone you've supported, getting some verification from a supervisor that it's legitimate, that would be the way that would happen. But yes, of course. In fact, that would be fantastic and really credible. And the AI engine would analyze that highly. It would recognize that it was from a real customer when it was doing the analysis.
It also does map it from, at the end of the day, it's still going to be a person who reviews this and makes the decision, because you've got to keep the human in the loop. But what this does is take that laborious analysis of information. But I think particularly in this sector, what's really important is that the process would help an individual to actually discover the extent of skills that they actually have by having that conversation of questioning about what they've done. Because a lot of people will say, you know, I don't have any skills because I just looked after my mother or my child, and that's
So
it.
where I can see this is invaluable, and I'm not sure if you've gone into that sector yet, is in the care inclusive workplace strategy, because I know Future Women are running it, a couple of other organizations, and this is what we're trying to do. We're trying to help unpaid carers recognize and gather their lifetime of experience, so that when they're either not caring anymore, or their caring is minimizing, to help them re-enter the workforce. This is the perfect thing for them to do that.
One of the things I'll just summarize in a second, but let me just show the last part of the process, that what you do is you package your skill when you feel like you've got enough evidence, and 84% is a very high score. You would say someone really has got the experience and qualifications for that. You can then view the package skill, which is like a credential that says the evidence, here's the evidence, here's the detail, and this can be viewed by a reviewer. At the moment by copying a URL, but in organizational contexts, we have a future process where a reviewer can go in and look at a group of people that might be working for them or part of a training cohort. And you can see here right at the detailed task level, we've got data and information, and also you can look at the actual evidence to ensure that it's legitimate and so on. So that's the thing. It does, this very short overview does lead to a number of questions, but the last thing I'd like to just add before we, just get some feedback on it is one of the things we realize is that there's a lot of talk about skills portability and skills-based hiring, skills-based resourcing, skills mobility, but our institutional arrangements have not changed to take advantage of it. So we realize that we're pushing change, we're asking for change, but we're a values-based organisation, and what we want to do is make sure that recognition becomes open rather than closed. And we think it's far too closed now, and for all of the grand policy statements people are making, they're just not backing it up with change and funding change, and that's what's needed for this type of system. And we think we do a great job with this, and we've internationalized this. We're doing it in French, even for a French project in Canada, for people who are native French speakers. So we've got big future ambitions for being able to do this on a global scale. But lots of people are interested in this and are trying to work in the problem, but it needs more support, more vision at a leadership level. In my view. But anyway, that's an overview. I'll stop sharing now and just wonder if there's some reactions to that. Yeah.
I think too, the other important thing, Mark, is that we are seeing that with institutionalized training, we're seeing less and less workplace training happening in a workplace, because it's often cited as hard and difficult to scale, etc. But and so the importance then of recognizing what people's life-wide experience is actually becomes even more critical, not less critical. And so you need to have a way in which you can have a mechanism for individuals to actually recognize that, and particularly in volunteer capacities, because there isn't a formal way for you to sort of say, other than I volunteer. Right, and people make their own judgments of what that is. Whereas, particularly, for the extent of what people learn in that process can be extraordinary, and yet we don't even try and codify it. So I think the other fundamental thing from what we've done in designing this that is different is we're saying the information should be owned by the individual and held and maintained by the individual, and they need to give the permissions to access it, because we're obsessed about privacy. So that's really important. And yet, if you think about how much individuals' information is locked in HR systems, which as soon as they move to a different organisation, totally gets lost.
So if I could have, fireworks and noises, I'd go, it's amazing, and massive audiences clapping. So just pretend that happened. Look, I think it's fantastic. I think Yasmin and I have talked about this for many years. It's completely essential. And I think the movement where we're going in society is around self-management. It's around self-managed super. It's around, self-managing and agency and self-determination and all of those fabulous words that mean things. And so we need people to own their own histories, own their backgrounds, and own their stories. And this helps them with a narrative that they currently don't have. So I think for me, that's the really important thing. I don't know whether it does, but it would be lovely if it could come out with a summary that sort of says, this is from all of that, this is kind of who I am, and then help them build their LinkedIn profile.
Yes.
I know that AI exists, but
No, that's the final point. We do that. I just didn't show the reports we currently have. But
that's fantastic. The only bit I'd question is the piece, I guess, in terms of the fidelity of the model and what you keep saying is at the center, is this piece around and I will harp on about it because it's important to me, around the customer feedback. So, a lot of people don't have, like my entire team for my daughter we're self-managed independent workers. There is no organization to go to for them to verify those customer statements. And those customer statements are what matter to me. When I'm choosing a support worker, I don't care less what excellent care organization says Yasmin can do. I care about what the people that Yasmin's delivering that care to, how they experience her. And so, how parents say, Yasmin comes in and does this amazing work. So I think an ability, because we have so many, just thinking about platforms and independent workers, they don't need, and they shouldn't need, an organization that just looks at their role in terms of a compliance response. Yasmin turns up to work, she's never had a complaint about it. That's not what matters to me. What matters to me is how it feels when she supports me. So that's the piece that I would just want to elevate a little bit, is how important the direct response that does not have to be verified by an organization, because in this world right now, there may not be an organization to verify. And how important is that? The most important person's voice is that person who receives the support.
Yeah, so that's a great point. Thank you.
Above your head. It doesn't have to all be like that. And there's no way anyone's entire story would be about, self-management, obviously, but I think it's critical, and it's all that matters to us receiving the support, is what does that support feel like? How do I experience it? And this has been my problem with providers. You don't know what happens in people's homes. We don't go and check how the shower was done. The best person to ask how the shower was is the person who had the shower. How did Yasmin shower you? She was gentle, she was slow, she was kind, not, shower done in 10 minutes, showered. So it's just, how do we layer that in a way that is really meaningful?
And the opportunity is there to put it in as, information from the individual. It's this whole, I suppose, mentality of, verification, right? I mean, you can make
up. Yeah, but it's what you're trying to break,
But
and also you're more than happy. Like, I'm more than happy my workers are for people to ring them. So I make sure that I ring. If someone says, oh, these are my reviews, I ring them first and I call those people and I go, can you tell me, just to verify it? So I'm verifying it. Like, I think we have to go even deeper to verification is really important. It's where it happens that we need to change.
Yeah. And I think that's why we think it's critical that you have a human in the loop. You have to have someone who actually looks at the information and then makes the judgment. What this is about is having a broad spectrum of information that is making the judgment, not just on, I did a course.
Look, and I absolutely love it, and I can think of several other spaces that I can help you get into where, as I said, this unpaid carers piece could be an absolute game changer, because finding the evidence and creating the narrative and telling the story differently is where the challenges are happening. And so I think there's so many spaces where it could really change the game. So congratulations. Very exciting.
It's great feedback. Thank you, Meredith.
Thanks, Meredith. And look, that's all we've got time for. So thank you very much, and have a great rest of your day. And we look forward, Meredith, to working out how we can change the dial.
Go forth, disrupt and improve. And be kind. Thanks, everyone.
Thanks, Meredith. Thanks, Mark.
Thanks for tuning into this SkillsAware podcast episode. Don't forget to follow us on your podcast app so you don't miss a thing, and be sure to visit our website at skillsaware.com to learn more.